The knee joint is only capable of two movements, flexion and extension. At the back, the hamstrings insert into the posterior surface of the tibia, and are therefore knee flexors, along with the gracilis and sartorius. The quadriceps and the anterior compartment are the knee extensors, supplied by the femoral nerve. In order to flex the fully extended knee, the knee must be unlocked, and this is achieved by the popliteus muscle laterally rotating the femur. Popliteus attaches inside the knee joint capsule at the back to the lateral epicondyle of the femur and winds round into the posterior aspect of the tibia. So once again, popliteus is a lateral rotator of the femur, which begins the extension of the knee. Begins the flexion of the knee from its fully extended position. It's supplied by the tibial nerve, which is one of the branches of the sciatic nerve, L4 to S3. The femoral triangle is the space contained between the anterior and medial compartments of the thigh. Superiorly, it's bordered by the inguinal ligament, and it contains the femoral neurovascular bundle, having passed underneath the inguinal ligament. Its floor is formed out of three muscles, the iliopsoas, pectineus and adductor longus. The roof of the triangle is the fascia lata of the thigh. The saphenous opening under the inguinal ligament, or rather refers to the break in the muscle where the saphenous vein emerges, is surrounded by fascia called cribriform fascia, which means perforated. Below the sartorius muscle is the adductor canal, which contains the femoral vein, femoral artery, and saphenous nerve, with the femoral nerve just going above it. The femoral triangle also contains the femoral artery, midway between the acis and the pubic symphysis at the mid-inguinal point, and it's palpated about a finger breadth below this. And it's slightly different to the inguinal ligament midpoint because that goes to the pubic tubercle rather than the symphysis. But the midpoint of the ligament is actually the marking for the nerve, whereas the artery is just above it, or the artery is the mid-inguinal point. Most medial is the femoral vein, and medial to this, the deep inguinal lymphatics. And all of these three structures are contained within the fascial femoral sheath. The popliteal fossa is at the back of the knee, bordered by the hamstrings and by the gastrocnemius muscle below. The roof is formed by popliteal fascia and floor by the femur bone itself. Its deepest structure is the popliteal artery, the continuation of the femoral artery having emerged from the adductor hiatus. By this point, the sciatic nerve is divided into two different nerves, the tibial and common fibular or peroneal nerve. These two branches converge, or parts of them converge to form the sural nerve, which is closely associated with the popliteal vein, having received the small saphenous vein.